So friends, we are going to discuss today the management of some acute illnesses. Now, this is one domain in homeopathy which requires tremendous amount of skill and knowledge on the part of homeopathic physician, because there is a marked difference when you treat an acute condition and when you treat a chronic condition. In acute conditions, patients usually come without appointment suddenly, and usually you will be not prepared with what you are going to see. While in a chronic condition, you know in advance what sort of patient you are going to see. In acute condition, the symptoms come so fast that unless and until you don't treat it immediately and give a relief, there are chances that you may lose a patient, and this may give a bad reputation either to you or to homeopathy. Also, many times in acute condition you have no chance to repertorize, no chance to open your book, no chance to take the case home and study. So the knowledge, the skill, the differential diagnosis between the remedy and the disease should be on your fingertips. Otherwise, every second is very important, and the disease may progress very fast if you delay in starting the treatment. And last but not the least is the result. The result which the patient experiences with the homeopathic treatment in an acute condition will be his most important memory of his lifetime, that he, his family members and his friends will never forget, even after years of the disease. So, with this beginning introductory comments, I would like to touch upon the subject of acute illnesses. Now, as you know that Hahnemann was the first physician who differentiated the disease accordingly, nosologically, what we call as the acute illnesses and the chronic diseases. And he says that the acute illnesses are basically of two types. The one which comes in an epidemic and the one which occurs sporadically. Here we are talking more of a sporadic acute illnesses. Now, in a setup in Bombay where I practice in India, about 35 to 40% of patients on day-to-day basis are mostly acute. And over a period of last 22 years, we have gathered experience not only in treating cough and cold or viral infection, but many pathological conditions, surgical conditions, gynecological conditions, neurological conditions, conditions that definitely demand a very high skill, a very huge knowledge on behalf of the physician, where there is a question of what is known as a life and death. In fact, we train physician in the art of critical care medicine and homeopathy. So, no discussion is complete without a practical experience. And as I will show you some cases, I am sure you will be able to gain some insight into the treatment of acute illness. Our first case for today will be a case of a child who I am treating for a very long time for his behavioral problem and dyslexia. He has got severe dyslexia. Academically, he is very poor. He has also got a behavioral problem. His constitutional medicine is Medorinum. And one fine day, he walks into my clinic with a pain in the right hypochondrium, and I tried to ask him some questions to find out any aggravating factors, but he is not very sure about what aggravates his pain and what gives him relief. But it was just merely a pain in the right hypochondrium. And then I asked him to take inspiration and put my stethoscope on the painful area. And he then says that when he makes an attempt to inspire deeply, there is a pain in that particular part. Definitely this was not a pain which he was trying to act or malign. It was a genuine pain, and hence I advise him to be under my observation for 24 hours. It is very important that when you don't understand the disease on the first day, you should keep the patient under observation, because that will save your skin later on. And so the next day, we again ask him to come, but this time his pain has increased about 10-fold times. When I mentioned to you that we kept him under observation means no medicine was given, and we had asked his parents to inform us on SOS basis. Because he stays very close to our health center, homeopathic health center, we took the risk of observation in his own house. Otherwise, such patients we usually try to admit them in a hospital and then observe. Now, so we'll start the video now, and let us see how he behaves.
Okay. What is happening to you? What is the problem? Since when?
Yesterday.
All of a sudden, since yesterday, the pain has started. He complains of pain in the right iliac fossa, which has started since yesterday, all of a sudden. What else is happening?
Now, the most important rule whenever you are treating a very acute case is the art of observation. And the moment the person starts talking with you in acute condition, if he is conscious, you should pay importance to certain things. The most important is how he describes his complaints. This is very, very important. His speech, which is very important, and the gesture. Now, in the above case, you will see that the speech is definitely soft. He is trying to put the inner lips into the mouth while talking. There is definitely an exertion on his part to answer the question about his pain, and this is the observation so far.
What makes the pain worse? Okay. He says that the pain is worse when he is walking from the slightest jar. It is aggravated when he is lying on the left side, and it is better when he is lying on the back or onto the right side.
You saw how he is trying to So this is a very important observation. This you should not miss in the case.
What he does?
He put his lips,
Can you
Mouth.
see? Yeah.
yeah, and the perspiration.
Can you see this or not? It's a very important part.
The pain in the right iliac fossa is aggravated by lying on the back, aggravated while he is turning on bed. It is better by lying on the left side. It is better by bending his knees and pulling it upwards towards the abdomen. On examination, the findings are of classical acute appendicitis, where there is marked rigidity of the abdomen, tenderness on pressure. The palms are absolutely cold, especially the fingertips, and lips appear pinkish. His pulse is 81 per minute, temperature is 99.1 degree Fahrenheit. His appetite is okay, thirst is normal, urine and stool is fine. How are you feeling today?
Yes, fine.
What about your pain?
It's very less.
Very less, meaning how much percent less as compared to the day when you had come to us?
Too less. At work. While walking, coming over, I have a pain. Yes.
Pain in the legs. But what about the pain in the stomach that you had? The pain is not there at all, or it is there a little?
Sometimes I have
Any other complaint, any other symptoms? Any nausea, vomiting? How is your appetite? Are you taking enough quantity of food?
I can't even eat well. Potato and bread.
Yes.
Bread. We are taking that much.
Do you feel hungry? Do you ask for food? Any change in your thirst? You're taking adequate amount of water, or you don't feel thirsty at all?
I take
What about your stool and urine?
last 3 days I had.
You passed stools. What was the character of stools? Very hard, so much so that you had to strain a lot. What about the urine? Any problems in urination? Any burning? Okay, any pain while passing stools? Any bleeding? Mucus in stools? Something sticky? Nothing like that. How is your sleep?
Now you see over here is that a person comes with a pain, and the pain is restricted more to the right iliac fossa. Now this is very characteristic of appendicitis, that usually the pain is always associated with constipation. Usually you will get in a history in appendicitis that a person has not passed stool since previous 1 or 2 days, or the stools were not satisfactory, or they were very scanty stools. With then the pain starts. It's very important that in appendicitis you have to be very careful with a child more than an adult, because chances of complications are extremely high in a pediatric age group as compared to the adults, because in pediatric age group, in a child, the mesentery, the quantity of mesentery, that is the fat tissue within the abdomen, is very scanty, and hence what happens over here is that the spread of infection can take place very fast. You can have peritonitis, you can have rupture, you can have many complications. While in an adult, because of an abundant amount of mesentery available, the chances that the infection gets localized are very strong. Second most important thing is never give purgatives in a person who has got appendicitis. Or when you are suspecting appendicitis in any person, don't give any purgatives, because giving purgatives in appendicitis will ruin the person's problem. It will burst and you will invite a lot of complications for yourself. So you have to be very careful. These are some salient features which I would like to tell you. Now when you are suspecting appendicitis, the first thing is that you should give a complete bed rest and keep the person almost on a liquid diet. Never give a solid diet to a person whom you are suspecting appendicitis, and the best thing would be to put him on glucose and fruit juices. That's all. Sometimes appendix is accompanied by low grade fever, but never a very high grade fever. Now the type of pain in appendicitis is always intermittent. That means it comes, stays for some time and then goes away. So this is very important and a characteristic type of pain in appendicitis. It comes, it stays, it goes. It's an intermittent paroxysmal pain. This is what you call as colic. The short term or a common man or a layman's language is, it is known as a colic. It comes, stays and goes. Now here let us pay importance to the modality of the person. Now in acute condition, this is very important. More than the ameliorating factor, it is always the aggravating factor which are to be given importance in acute condition. The first and the most important aggravating factor in this man is jarring or motion of any sort. He just can't move. He just can't bear any jarring, any walking. Second most important thing is that he cannot turn on any side. If he turns on left, he is aggravated. If he turns on right, he is aggravated. Only comfortable position is if he lies on the back. So this is also a very important aspect. The pain is so severe that he is hardly able to move in any particular direction. There is no appetite. He has not passed the stool on that day. So these are his acute manifestations, but otherwise he is very conscious, he is very cooperative. There is a very minimum anxiety, otherwise there is not much anxiety or fear. So here the importance has to be given more on the physical symptom. The gesture what you saw basically of trying to put the lips within the mouth is a very misguiding symptom over here. Even though this symptom has nothing to do with his appendicitis, this symptom is a very old symptom of this boy because this even existed before appendicitis, which we confirm with the parents. So this is very important that don't jump to conclusion moment you see in an acute condition, this is like that and I have to take it. No. You have to first ask the parents whether this symptom was there even before the person developed illness. If the answer is yes, then it does not have much value. And you will see that even after the attack got over in 24 hours, the lip sucking or lip picking is still there. That means this has nothing to do basically with the appendicitis. Of course, if your remedy that you select covers it, it is well and good. But otherwise, this is not so important. I will show you some cases where this has been a very leading factor for us to prescribe a remedy. Like in our pediatric age group, whenever we see this type of an individual who tries to pick the lips like this, or sucks, or constantly play with the lips, this is highly indicative of a remedy, arum triphyllum. Arum is a very important remedy, arum triphyllum, or bryonia. Kent has described innumerable cases of fever in a child with senna, chamomilla and bryonia, where this type of lip picking or lip sucking was present. So Kent gives very importance to senna, chamomilla and bryonia. While the bony motion repertory, you will see that stramonium and lachesis comes very high. In fact, there are cases in literature where Vitulkas is prescribed for a case of fever on this particular indication where he gave lachesis on picking of the lips. There are many remedies including tarantula, helleborus, calibrome, arsenic, arnica, phosphoric acid, and Fatak gives tarantula and thuja as an important remedy. So this rubric requires a proper study. Now back to the case. You have seen the person, practically when he came to the clinic, he was holding the hand on the abdomen, bending in forward like this and trying to walk. So the pain in abdomen is such that it makes the person bends forward. The pain in abdomen is such that he has to hold the abdomen, hold the painful part with his hand. He has to support the painful part with his hand. So these are the important symptoms of the patient. The reason why he wants to hold is because he can't bear any jar, cannot bear any jerk.
So, Bryonia?
Very good. I think so. This was the first indication that we saw, because immediately picking of the lips, jarring aggravates. Even previously, if you saw, he had a cough which was worse deep inspiration.
What I noticed is also that his left eye was hanging. I don't know whether I saw it right.
Hanging is what?
Yeah, his left eye. Yeah, his
Left upper.
yeah, his upper eyelid.
Pain in